Hi, Dr. Vo here. I'm a cataract and refractive eye surgeon. One of the most rewarding aspects of being a cataract surgeon is seeing my patients thrilled about their new vision after having had cataract surgery. But what if you just had cataract surgery and your vision is still blurry? Don't worry, you're not alone. Even if your surgery goes perfectly, it's normal for your vision to be a little foggy, hazy, or not as sharp as you expected. In most cases, it gets better with time as the eye heals. However, there are different reasons why your vision can still be blurry. Some are no cause for concern, while others may need attention. In today's video, we'll discuss some of the most common reasons for blurry vision after cataract surgery. First, let's look at the first 24 to 72 hours after surgery. Corneal swelling, also known as corneal edema. This is the number one reason for blurry vision in the first few days after surgery. During cataract surgery, we use energy to break up the cloudy lens. That energy temporarily irritates the cornea and can cause it to swell with water. The cornea, which is the clear surface layer of your eye, becomes cloudy as it swells up. When your cornea is swollen, things can look foggy or hazy, almost like you're looking through a steamy window. A single layer of cells within your cornea, called the endothelial cells, are responsible for removing the fluid, thereby reducing the swelling. This results in a noticeable improvement in vision over the first few days following surgery. If your cataract was very dense, or if you had an underlying eye condition such as Fuchs dystrophy, which is a dysfunction of your endothelial cells, it actually may take a little longer for the corneal swelling to resolve. In more severe cases of corneal edema, where the swelling does not resolve completely and the vision remains blurry, additional surgery such as a corneal transplant may be required. However, this is rare and occurs in less than 1 in 5,000 cases. Reason number 2, tear film disruption or dry eyes. Surgery can temporarily disrupt your tear film. Even people who had zero dry eye symptoms before surgery can feel dryness afterwards. This may feel like there is sand in the eye or grittiness. Dryness is characterized by fluctuating blurriness, ghosting, or vision that's sharp one moment and soft the next. Using preservative-free artificial tears helps a lot, and things gradually improve over the first couple weeks. Reason number 3, residual dilation and viscoelastic. Your eyes are dilated for surgery, and the drops can keep your eyes blurry even into the next day. This may also make you extra sensitive to bright lights until the dilation wears off. We also place a clear gel inside your eye during surgery that can cause blurriness until your eye fully clears it. Next, we'll look at causes for blurry vision during the first few weeks to first month after surgery. Reason number 4, residual refractive error. This is when the lens implanted in your eye isn't a perfect match. Before we perform cataract surgery, we use a series of formulas based on your eye's specific measurements to determine which lens would be the best fit for you. However, these formulas are not perfect. If you had prior eye surgery such as LASIK, or if your eye has atypical measurements, then these formulas become less reliable. Small amounts of residual refractive error is not unusual and typically not visually significant. However, large amounts may leave you slightly nearsighted, farsighted, or with some astigmatism left over. If you're off by even 0.5 diopters, your vision may not be crystal clear. Glasses, contacts, or a laser enhancement can fix this if needed. Reason number 5, astigmatism. Residual astigmatism is another common cause for blurriness after cataract surgery. Even small amounts of astigmatism can blur your vision. For mild astigmatism, your surgeon may recommend performing small incisions into your cornea, either using a laser or a blade at the time of surgery to help relieve the astigmatism. However, for larger degrees of astigmatism, a toric lens implant is typically recommended. Alternatively, you can consider getting glasses after cataract surgery to address any residual astigmatism. Reason number 6 for blurry vision, posterior capsule folds. Right after surgery, the thin membrane behind your new lens can have some wrinkles or folds. These often smooth out on their own, but early on they can make lights look streaky, cause mild blur, or may appear as a line of light. For patients where these folds do not resolve and are causing symptoms, a YAG laser can be used to treat this issue. Reason number 7, inflammation. Inflammation after surgery is completely normal and expected. That's why we prescribe steroid and non-steroidal anti-inflammatory drops for you to use. Inflammation usually presents immediately after surgery and resolves during the first month following surgery. Inflammation can cause haziness or fuzzy vision, so it's important to follow your surgeon's instructions regarding eye drop usage. Do not discontinue too early, even if you feel completely back to normal. Next, we'll look at causes of blurry vision weeks to months after surgery. First, reason number 8, posterior capsule opacification, also known as PCO. This is one of the most common causes of blurry vision that can occur weeks, months, or even years after cataract surgery. A PCO is sometimes called a secondary cataract, but it's not a real cataract and doesn't require additional surgery. A PCO refers to clouding of the membrane that sits right behind your lens implant. Patients will usually describe that their vision seems more cloudy now, or not as sharp or clear as when they first had cataract surgery. Symptoms typically slowly progress, similar to how cataract symptoms present, and thus patients often complain that they think that their cataract is coming back. Symptoms may include glare and halos, you may have trouble reading street signs, night vision becomes hazy, vision that slowly and progressively gets worse, essentially feeling like the cataract is coming back. Similar to the folds in the capsule, a PCO can be treated with a painless laser procedure called a YAG capsulotomy. Reason number 9, cystoid macular edema or CME. This refers to swelling of the retina in the back of your eye. Typically, this shows up around 4 to 6 weeks after surgery. Clinically significant CME, however, is not common and is estimated to occur in less than 2.5% of patients after cataract surgery. It can cause blurring or distorted central vision, which is more noticeable during certain activities such as reading. Most cases can be treated with anti-inflammatory drops such as steroids or NSAIDs, and in most cases, it does completely resolve. Keep in mind that certain pre-existing conditions, however, such as diabetes, will increase your risk for developing CME. Reason number 10, persistent dry eyes or meibomian gland disease. Sometimes your dry eye might not go away immediately, especially if you had dry eyes even before surgery. Over-the-counter lubricating eye drops do help, but some patients need additional treatments such as warm compresses, lid wipes, or prescription dry eye drops. Please check the description down below for some of my favorite over-the-counter dry eye treatments. Let's move on to section 4, lens-related factors. Reason number 11, adapting to multifocal or extended depth of focus lenses. If you received a premium lens like the Panoptix Vivity, Odyssey, or Envy, it's normal for your brain to take time to adapt to the new lens. You may notice symptoms like halos, starburst, or decreased contrast sensitivity. Most patients fully adapt and do great with these new lenses, but it may take anywhere from 6 to 12 months to fully adapt, so be patient. Reason number 12, lens tilt or decentration. In rare cases, the lens implanted can tilt slightly or shift off center. This usually causes vision that never quite feels crisp and can't be fixed with just glasses. If this happens, your surgeon will discuss with you whether it's better to observe, to see if it will resolve on its own, or if it's better to proceed with a repositioning of the lens. Section 5, pre-existing eye conditions. Reason number 13, retinal, optic nerve, and corneal conditions. Even with successful cataract surgery, pre-existing eye conditions may limit your visual potential, resulting in persisting blurry vision. Some of the more common examples include macular degeneration, glaucoma, epiretinal membranes, previous retinal vein occlusion, diabetic retinopathy, corneal scarring, and amblyopia, which is also known as lazy eye. Cataract surgery cannot fix these issues. It's important to discuss with your surgeon prior to surgery about expected results after surgery, especially if you have one of these conditions. Lastly, section 6. When should you call your surgeon regarding your blurry vision? Most cases of blurry vision after cataract surgery should not cause alarm, but there are some symptoms where you should contact your doctor right away. This includes sudden decrease in vision, increasing pain, significant redness of the eye, flashes or floaters, or sensation of a curtain falling over your vision, glare or blur that suddenly gets worse. If in doubt, reach out to your surgeon. We would rather it be nothing than to miss something critical. That's it. Those are the most common reasons for blurry vision following cataract surgery. As you can see, most are manageable and easily treatable. However, it's important to pay close attention to things as your eye heals. If in doubt, don't hesitate to reach out to your surgeon. If you found this video helpful, please make sure to like and subscribe. If you already had cataract surgery, let me know in the comments below if you experienced blurry vision after your surgery. Take care. I'll see you in the next video. Bye.